Hi everyone, my name's Jess and I'm a final year adult and mental health nursing student at the University of Southampton. I'm here today with a few of my peers to talk about our experiences at Southampton before you guys start. Now, we are recording this in the middle of COVID-19, which is why we're in our various houses, or I think one of us is actually on placement at the moment and is doing this in their lunch break. Thank you very much. Yeah, we're going to try and give you a bit of a flavour of what it's like to be at Southampton, but obviously bearing in mind that a lot of us don't know what's happening next. But what's really important to us is about you feeling welcome and being part of this community, which is going on regardless of how spread out we are across the country, the fact that we can't really see each other that much face to face at the moment. We're still University of Southampton students and staff, and yeah, we would love for you to join us. So before we crack on with me asking these guys a load of questions, I thought it would be nice if they introduced themselves. So over to you guys.
Hello, so my name's Pim. I'm a second year adult and mental health nursing student.
Hi guys, my name's May. I'm a second year adult and child nursing student.
Hi guys, my name is Julia and I'm a second year adult and child student.
Hello, I'm Emily and I'm a second year adult and child nursing student as well.
So as you can see, we are definitely flying the dual field flag here. Unfortunately, some of our single field colleagues weren't available today, but there are single field students as well. But we've got a good spread of the fields between us, so hopefully we'll be able to cover some of that. So as I've said, we are in different locations, and this is a bit strange for us because we normally do this face to face and take your questions, but based on our experiences of doing a lot of selection sessions and open days, we kind of know the kind of questions that tend to pop up. So I'm going to ask these guys some questions and then they're going to answer them based on their experiences on things like placement experiences that they've had, the social aspect of university, staff support within health sciences, which is the school that you'll be part of, assessment types, accommodation for when you're able to move to Southampton, the wider support from the university, and just a few kind of signposting bits, things like our social media and stuff like that. So that does seem quite a lot to pack in, but we can do it. So if you guys wouldn't mind, if we go round and if you could tell me about your one placement experience, and I'm hoping we'll get a spread across the fields by doing this. So over to you.
So my favourite placement actually probably was my first placement. So I was in a community mental health team locally. I was very scared going in. I hadn't worked in the setting before. It was my first placement, didn't know what I was doing. But it was absolutely fantastic. I worked with a very supportive group of staff and really, really enjoyed working long term. So it was I think it was an 8-week placement at the time, working long term with the patients that we were seeing, and in particular for a couple of patients seeing their progression. So we saw them when they were very unwell at the start, and then gradually they got better and better, and it was fantastic just to see that progression, and it really set me up to get going on my next placements.
So my favourite placement was my second placement in first year. It was on a neurosurgical unit, and it's an area that I'm really interested in anyway. But the staff was so supportive. They enabled my learning, and I felt like when I got to the end of it, I felt prepared. I felt sort of very motivated, and that team helped me do that, and that placement helped me do that. So yeah, that's my favourite one.
Hello, so my favourite placement has been as well on my first year. It was my first placement ever in community. And it was a bit of a surprise because preparing for it, I was not really excited about it, but joining the team, feeling so welcome and having so many staff members dedicated and investing time on teaching and sharing their practice, and what really is the difference that you can make in the community has enabled me to make so many considerations in a hospital setting about discharging patients back to the community, what they will need, and feel really empowered that when I'm working alongside members of team that don't have much exposure to pressure areas or any dressing, I can be like, yes, I know what I'm doing, I can help. And yeah, it's something that will always carry in my heart, and really appreciate the community team because they've been an amazing experience for me.
So my favourite placement was actually my second placement in first year, which was with the children's community nurses. And I had written off community nursing before I started. I wasn't really that fussed by it. I just wanted acute. All of that was so interesting to me. But then obviously I had to go on this community placement and I absolutely loved it. It completely opened my eyes to everything. These children had really quite complex health conditions, and watching them throughout my placement was just amazing. And like being able to support them to stay at home and like reduce their hospital admissions just made such a difference to their lives and their parents as well. So yeah, it was absolutely brilliant. I really wish I hadn't written it off, but I'm so glad I had that opportunity.
Fab. So yeah, we've got a good mix there, and it's really lovely to see at the centre of all of it is the patient care. So thank you very much for sharing those experiences, guys. So the next one, which may be a bit tricky, is social life in general. Now, I know that for our students that are starting in September, this may look slightly different, but at the heart of it is still that you're going to be part of the University of Southampton community. So I thought maybe I could hand over to you guys to you've all got a little something that you want to say on the social aspect. So over to you.
One of the things when I came in, I was a bit apprehensive because I started in my mid-30s and I thought, I don't know what this is going to be like. They're all going to be 17, which is not true, very much not true. And the 17-year-olds are lovely too. But there's a group of us who are older. We've formed a good friendship group, and actually even in this time when we can't meet face to face, we're still managing to do things virtually. So we've got a virtual quiz every week. We did start on university related topics. We did start on anatomy and physiology, but we've just gone off onto random things now. But it's really nice to be able to have that regular weekly contact, even when we're all locked down and doing different things.
So one thing I was really interested in, both in first year and second year, was sports. I very much like being active, and it's a way for me to socialise. So my first year, I joined the rowing team. And a lot of people, I think, are quite anxious when they come to uni and start a nursing degree that they won't have time for other things. And that's very much not true. I feel that as long as you manage your time well, I had enough time for my rowing, my placement, my uni work. It's all manageable. It's just knowing what you can do and can't do and caring for yourself at the same time. So first year I did rowing, and then second year I joined the netball team full of nurses. And this has been really helpful actually, because when I was on placement and I wasn't able to go to training or to play matches, they were very understanding, and everyone's in the same boat. You're able to talk about placement and uni, but also not, and you're able to talk about everything and encompass nursing and social life. So that's been really useful for me.
So, echoing what Pim said, I am much older than I look, and I was really concerned about how I'm going to insert myself, will I fit in, and actually it's been a pleasure saying that. It's been amazing since the very beginning. I am grateful the tutor group that I had. The girls made me feel always welcome, and despite not living in Southampton, I always felt included and welcome to any social that was extra from uni. But also finding myself more interested in other aspects of academic learning. There are plenty of options within societies, so you get to meet people that are healthcare related but not necessarily nursing, and you learn so much from them, and you realize how much in common you have and how much similar are your placement experience. So it's amazing. And sometimes you might feel when you start on your first year a little bit lonely and thinking that everyone is socializing but you. Just is not true. Everyone feels the same. There's going to be that couple of days that you feel like, oh, I'm so lonely, far away from home, far away from my friends. But actually, you got plenty of people that will reach out to you, look after you, and really care about you. So sometimes it's just a matter of saying, I do feel lonely. Please reach out to me.
So kind of following on from that, I want to talk a bit about online peer support that we've had. as Julie just said, it's not essential that you are always constantly doing something. I wasn't particularly part of anything in first year. I didn't join any societies or anything like that. But I was happy with that. And I had my friendship groups from that were nurses. I had my flatmates, everything like that. So it's not for everybody. But especially during this time when we all can't be together in person, it's been really interesting and great to see how everybody has adapted to not being able to go to uni and speak properly. We've got quite a few different platforms that everybody can speak on. We've still had our support sessions for the modules that we're doing. Everything is still happening, it's just happening in another way. So yeah, I just kind of wanted to acknowledge that we're not really missing out as such, because that support is still there. And I don't know what it's going to be like at the start of next year, whether that's still going to be the same, but I just kind of wanted to reassure you that there is still that support there for you.
Thanks, everyone. And Emily's doing herself a bit of a disservice, if I'm honest with you. So Emily is also one of the curators on a national peer support network. So sorry, Emily, to put you on the spot, but I don't know if you wanted to speak about the kind of support that's available to nursing students, no matter where you are in the country as well, that you're part of.
Yeah, definitely. So I am one of the student curators of the Student Nurse Project. Find us on Twitter and on Facebook and on Instagram. So we are a group of student and newly qualified nurses from across the country who are obviously all doing completely different degrees, completely different universities, but we kind of come together to support everybody. So our Twitter accounts, our Instagram accounts, all revolves around student nurse and newly qualified nurse support. So we have on the Instagram, for example, we have different topics every day. We have like Top Tip Tuesday, which can be really, really helpful for people who kind of like, you know, just kind of want to push themselves a little bit further, or they aren't quite sure about something, or like even brings up stuff that you haven't even thought about. Or like Wobble Wednesday, where everybody can just offload and you've got all these different opinions from so many people who have different experiences. And it's just a really great support network. So yes, do go have a look at social media. Obviously, yeah, there is the Student Nurse Project, but there's so many more as well. There's like We Student Nurses. I can't think of any more on the top of my head, but there is loads. So yeah, go have a look.
Thank you. RCN Students is also available. Not that I have a vested interest, but thank you, everyone. So the next section that I thought we could have a little quick chat about, without naming any names because we don't want to embarrass them, but can you talk to me a bit about the staff support that you've received from our health sciences staff? Over to you.
So one of the things I thought was worth talking about is that obviously we've moved on to online learning now, and that may or may not be the case when people start in September, but some of the staff have actually been really responsive to that. So we had it was a new module for us anyway, and we had a couple of seminars scheduled, and a couple of us were going, we'd quite like some more. And we actually asked one of our lecturers who immediately came back saying, yes, absolutely, we didn't want to overload you, but if you want something, we'll do it. We had a really good group session. We did it in teams, we all split off, so we got to interact with each other, and then we had the interaction with the staff as well. And it was really nice to see that they're learning how to do this stuff, but they're really responsive to what we want as well. So that was quite nice.
One thing that I found really useful, both in university and in the online learning world, is the Wednesday support session. So every week, program leads or module leads will come into what's a Teams group now, but it's usually just a room in the university, and you'll be able to ask any questions that you want, assessments, modules, anything. And if they don't know the answer, then they'll get back to you. And that's one thing I found really useful, is all the people within the university and within your programs and seminars and everything, they're easily accessible to you. And if they can't get back to you on that day, they'll get back to you at some point, and they can always point you in different directions. So that's what I found really useful, is that the students and the academic leads and people are very linked, that's one thing that's been really good to see.
One thing I feel is worth mentioning is how amazing some of our lecturers are. Well, most of them are fantastic and super, but some of them go way beyond the road to support you. So when there will be times where you may experience difficulties, because as it is, caring for others is not always easy, and sometimes it's very demanding on ourselves. There is so much more than is given from them, from what is expected. So they will be available on a number of ways, phone calls when you're on placement. If they know you're experiencing a struggle, they'll be proactive on checking on you. And they'll be the kind of person that they take you out for a tea and say, it's okay, it's fine not to be okay. And we've been there, and have no shame in sharing their own embarrassing story when they started. And there's nothing that make you feel more fine with yourself than your amazing, super achieving lecturers being like, well, we are all human, we all did something silly, and sharing a good old story, making you laugh and feeling a bit better about yourself. Because at the end of the day, most universities have great lecturers, but ours feels more like family. I dare to say that we are really united as a community, and it's nice to know that you're part of something bigger. And actually, when you go out on practice, you as well recognize that you belong to something bigger. So yeah, that's me.
So I wanted to touch a little bit on your kind of key staff, the more pastoral support. So tutor groups especially, obviously you are a cohort and everybody's kind of going through the same thing, but your tutor group, you form a special bond with them. It's so lovely to have a small group of people and that one member of academic staff who really knows you. They get you, they make the time to find out about you as well, so they can support you when things happen. And that's still gone on when we've been going through this all this online learning. We've still had tutor meetings regularly. My tutor's always on the end of an email and will reply very quickly. Yeah, I think it's always important, but it's just good to see that it's still happening now while we're doing online learning too.
If I can chip with one last thing, is that, as Emily was saying as well, the staff has been super responsive to our needs. When the program is being redesigned, students have been consulted, and one thing that came up was there was need of more support around placements. So, or other than the tutor that is the personal academic tutor that is available for pastoral support, now we do have personal professionals groups. So one member of staff dedicated to a much smaller number of students that share the same group, either dual fields or single fields, and we'll discuss them in more depth. Their placement experience will support them in that extra way. And I think it's just amazing to recognize how responsive they are to our needs and how much they dedicate to us. So yeah.
Thank you, everyone. And if I may, I'd also like to give a special shout out to those members of staff that wouldn't, normally automatically come to the front of your mind. So from our staff in the student office, who are always there to help us. They take in our timesheets. They do a lot more than timesheets, but they are, normally one of the first ports of call that you get. From our technicians in our skills rooms, who make sure that the equipment is there for us to use, so that we can practice before we go out on placement or in the middle of placement as well. Obviously our academics, which you've all spoken about, and our personal academic tutors. But also, for me, a top tip for any of you is to don't be afraid of the job title. So I have had great working relationships with more senior members of staff because I have asked them for advice or I've approached them. They are very approachable. So yeah, just all of those other members of staff as well. Thank you very much. Oh, including our events team as well. So who set up these events, and they run the open days and the selection sessions and stuff. So we can't forget them. So we're coming to the end, so well done for those of you who have been with us this whole time. So we've got a couple more things to go over. So the next one, guys, is around assessment. So we have a variety of assessment methods at Southampton. So I'm hoping by going around you quickly, you can tell me what, if any, was your favourite method of assessment and why.
My favourite assessment, it wasn't actually about the assessment, so it was a group presentation, and I'm not a big fan of group presentations on the whole, but it was really good because we did it in our tutor group, and it really helped our group to come together and work together. And yeah, we were moaning during most of it, but it was a really good thing, and we produced a good piece of work at the end of it, so it was nice also to have a bit of variation as well, so that was good.
In terms of we did an exam on clinical assessment and planning care, and we had to do 2 as dual field students. So I did adult and child, and it was one of the exams where I really feel that I learned a lot, and the programme leads and the lecturers, they helped us so much in that module, and it's where I feel I've got a basis of my assessment and care planning knowledge from that I will have with me for the rest of my career. So that has been my favourite most of all.
Right. For myself, it was supposed to be an exam that we should have had now. It became a formative, but my favourite model so far is being managing acute care needs. And I just love it. I am passionate by myself for emergency, so there were loads of practical insight, loads of reflection, lots of good pointers about reviewing more evidence-based guidelines, and as well very practical insight reflections. So yeah, that's been my favorite so far.
So I always preferred essays. I've never really liked exams. I can't deal with the pressure. I'd rather just have a week and be able to do it myself. But I've actually surprised myself since starting uni at how well I've kind of adapted to the exams, and that is down to the support, because at first we were given a couple of essays at first and I was in my element, I was absolutely fine, and then it came to exams and I just was like, no, don't like it, can't do it. But the amount of support that I was given to improve my exam technique, my revision technique as well, which was a big one, it's just been amazing. I've actually done really well out of it, and I couldn't have done that without the support from university.
Thanks, everyone. Great mix there. So the next point is around accommodation. And now we recognise that at the moment we don't know what's going to be happening in September, but May and Emily just wanted to give you a little bit of information on their experiences of accommodation when starting university.
Okay, I'll start? Okay. So in first year, so just to say, all first year students are guaranteed a place in halls if they want it. So just to reduce any sort of anxiety over what's going on, that's prioritised for you first year students. So my first year I was in Wessex Lane, which is a hall that's a 25-minute walk away from campus. And I've got to say, it was such a good experience. I was quite nervous moving away from home. I live quite far away from the uni, so I was nervous about what it would be like, how I would meet new people, what the support would be like, and it was amazing. There's a support network called Student Life there's a team in every student halls, and they helped so many of my friends, me, everyone that lives in halls. They support whenever you need it, and the facilities within the halls as well, it's always clean, there's always people to see and people to ask if you have any questions. So yeah, it was a very good experience for me, and I met some friends in halls that I will keep for the rest of my life. So that was my experience.
So like me, I did travel quite far from home to go to uni. I moved into Archers Road, and the actual halls were great. I didn't get on with my flatmates. We had a couple of issues, and I brought them up to Student Life, as May mentioned, and they were so very supportive. I was able to move to another halls. I moved to Glen Eyre, which again was great, and met some people who are a bit more like me. So I fitted in a lot better. And I just kind of wanted to emphasize that if you are in that situation, you're not stuck. You don't have to stay somewhere you feel uncomfortable. There is that support there and they will help you. So yeah, that's kind of what I wanted to say.
Thank you, guys. And that actually leads us on to our last section, which is around the wider support from university. And I know that Julia wanted to touch on this one.
So in terms of representation, as university, we always challenge ourselves to try to improve, because obviously we recognize that dealing with larger cohorts is really difficult to include all the feedback from everyone. So we try to work our best to improve ways and enable our reps to do a great job. Also, I'll say lecturers as well are really proactive about to try to pick up feedback. Whatever is said, they really try to understand what's been difficult or how it could be improved. And they take the time during our student liaison meetings to think about how we can improve for next year. So we always think about you guys coming and joining our community, but also says the whole general experience. So as May and Emily mentioned, there are supports network like Student Life, but there are also the Advice Center. SUSU also provide, there are multiple services available to support you. So it's a matter really finding which way will support you better. You can always, as well as a first port of call, shout for your part for help. Sometimes it's just a matter like, it's just not working, it's just difficult. And sometimes they just sit down with you and say, okay, we can sort this out together. I will address it there, or we support you. Because sometimes all that support is a bit like, where do I go? And it's nice to know there'll be someone that will be like, okay, we can do this together. We'll do it as a team. So yes, it's nice to know. And also a big shout out and thank you to you, Jess, and all there for the years. The amount of time that you've been there when I was like, I don't know what to do with myself. I want to try to achieve this. How do I take this forward? And you've always been available to share your experience, your knowledge, your incredible leadership skills. So yes, I hope that we will be able to do the same.
We're going to move on from that. Julia, but I guess the importance there is about the peer-to-peer support as well. So as Julia said, you know, there are loads of support services within health sciences as our school, within our FELS, which is our faculty, that's the word I was looking for. And also the wider university. So SUSU is our students' union. We also have support services from the university as well. And yeah, that peer-to-peer support, don't be afraid to find students who are in the years above you. Like my personal university experience has been enriched by, you know, being in contact with students who are in years above and years below me, and we all support each other. And I don't think people realise how important that is. Yeah, so support is very important, and it's there.
I just wanted to chip in for peer-to-peer support. So for this year, they've done what's called a buddy system. So I'm a buddy for the year below me, and so is Emily actually. But it's basically a system where you get a tutor group and you can ask any questions to your buddy about anything in particular, placement, life in general, anything, and they'll be able to point you towards it. And if they can't, they'll know where to go. So examples that I've had are assessment documents and social life and lecturers who to contact. And it's a way of easing the pressure away from having to contact so many people, because it's one link for a lot of people. And I just wanted to mention for academic support, actually, the library do a lot of different workshops for academic writing, for referencing, for everything like that. And even I just wanted to link it back to the support that the uni have given us. Actually, it's a lot of the students, while we're in online learning, have said that they've been struggling with the essay writing and what to do for next year. And the uni have proposed to give us lectures, or to contact the library staff about giving us lectures regarding referencing and academic writing. So yeah, that's another point that the uni have really been proactive with. So yeah.
Thank you for adding that. Very important. How could I forget the library? Like, they are absolutely amazing. And I'm sure there are things that we haven't covered here. It's really tricky to just squeeze it all in because honestly, there is so much. So next steps really is to signpost anyone watching this to the university website, because all the most up-to-date information is on there. And for health sciences specific stuff, which isn't just nursing, it's the other disciplines within health sciences as well. We have social media channels which you can follow. So health sciences have definitely got a Facebook and a Twitter page. So if you just type into Google University of Southampton Health Sciences, you will find it. And then you will also from that start to find, a lot of the student facing peer-to-peer type stuff as well. I have been reliably informed that there is a virtual open day coming up in June, which you can find that as well on the university website, and you need to book onto that. We definitely recommend that as part of the overall experience. Even if you've already got a place, it's just nice to kind of, have that interaction and, well, just be a bit nosy, I guess. So I would like to say a massive thank you to these guys for being part of it. So yeah, if you'd all like to unmute yourselves and just say a goodbye, that would be great. Thanks, everyone.
Bye.
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 Bye.